Welcome to Sonata Insights Live. I am Tara Murphy, Senior Director of Global Marketing and Advocacy at Gynesonics. Sonata Insights Live is a new program that we launched at Gynesonics to spark conversation about fibroids, the symptoms of fibroids, and your treatment options. During these episodes, you'll hear from guest physicians, patients, and advocates as they share their stories and educate our audience. Today, I am very excited to have two guests join us. I have Dr. David Levine, co-director of minimally invasive gynecologic surgery at Mercy Hospital in St. Louis. Dr. Levine was also the primary clinical investigator for the Sonata clinical trial. Welcome, Dr. Levine. And I also have Amy with us, who is a patient that had Sonata as a procedure in 2017 as a part of the clinical trial with Dr. Levine. Welcome, Amy. Thank you for sharing your story with us today.
Of course.
So I'd like to just start from the very beginning, Dr. Levine, and really talk about what uterine fibroids are. So if you could just tell us a little bit about what are fibroids.
Sure. Well, Tara, fibroids are benign muscle tumors that 80% of women have. And basically what they do is they cause either bleeding because of the size of the location of the fibroids. It increases menstrual flow, or causes pressure symptoms on the bladder or structures in and around the uterus. It also occasionally causes infertility. So there are a variety of reasons why we're very careful to watch the growth of fibroids and listen to the symptoms.
So you mentioned a few of the symptoms. Can you talk a little bit about what common symptoms are in addition to heavy menstrual bleeding that women can experience when they have fibroids?
Yeah, again, I hear heavy menstrual flow is probably the most common symptom that I hear about. And these things can be treated depending upon the size of the fibroid. It can be treated with hormonal suppression or a variety of simple things. However, as the fibroids grow larger or as the location changes of the fibroid, it's much more difficult to control the amount of heavy menstrual flow. And after a while, regardless of what you do, unless you're willing to intervene surgically, there isn't a heck of a lot you can do for the fibroids.
So Amy, let's talk a little bit about your journey of finding out that you had fibroids. What did you start to have as your initial symptoms before you knew that you had fibroids? What were you experiencing?
Exactly what Dr. Levine had mentioned, just heavy menstrual bleeding. My period just didn't stop. Like on day 14, 15, 16, day 30, day 35, and it just kept going and wouldn't stop. And then it would for a little bit, and maybe I would have, a week break, and then I would get my period again. So it was just this constant period that would not go away, which, ultimately really ends up impacting your life, right? Just making sure that you always have products with you or supplies, or, maybe if I push that trip off by a week, this heavy flow will actually be gone type of thing. So it definitely took a toll.
Dr. Levine, we are hearing, that Amy had these long cycles and they would go on for 14, 30 plus days. Can you talk a little bit about what is a normal menstrual cycle? Because I think a lot of times we don't know what actually is normal, and we think that these longer cycles are what other women are experiencing.
Yeah, Tara, that's a great question. I hear women say, well, I just thought this was normal. And typically women bleed once every month for 4 or 5 days. First couple days are light. They could have a heavy day in the middle and it tails off, and it's manageable. It can be managed with tampons or pads, depending upon what you prefer. But these aren't incapacitating bleeds. These are not situations where women are cowards or they have no idea when the flow is going to begin. So anybody who says to you, I bleed like this for 10 or 12 days, that is not normal bleeding. That's when you go to your gynecologist or your general practitioner and be evaluated for the amount of this flow, because it's just is not normal.
You know, a lot of times we hear from women, and I think you said it too, Amy, that you take a change of clothes and you just assume that that's what people are doing. I think a lot of times when women are suffering from fibroids, they've seen the women in their family, you know, having issues, taking changes of clothes, having these heavy cycles. So they think that that is what's normal. What are the factors from a family perspective? Like if your mom has fibroids or someone in your family has fibroids, are you more likely to have fibroids yourself?
You asking me or are you asking
You.
him?
Yeah.
Yeah, well, there's certainly a genetic link for women and their grandmother, their mother, their aunts who have had stories of heavy, large fibroids. They've all had hysterectomies by the time they were age 40. It's very much more common in the Black population. They're less common in Asians, and but there is definitely a genetic link for fibroids for sure.
And how do you know, what is the process that you have to go through, Dr. Levine, to know that you have fibroids?
Well, again, a lot of people don't even know that they have fibroids because they're totally asymptomatic. So most people go in for a yearly pelvic examination. And at that time, the gynecologist or again, the general practitioner might examine you and say, oh my goodness, this uterus that I felt last year is now significantly bigger. And then the questions begin about, well, is your flow heavier? Are you having any bladder pressure? Are you having, is it worse at the end of the cycle before your period? Does everything, whatever you have, is everything exacerbated before the period starts? And if the answer is yes, then the next natural thing to do is to get an ultrasound, which is the best way to identify fibroids. And so that starts the process.
Amy, how did you find out that you had fibroids, or what led you to the point of beyond your heavy bleeding that you said, okay, now I need to take this to the next step? Or how did you find out that you actually did have fibroids?
Honestly, it was because of the heavy bleeding. For myself, I went through this process of thinking, okay, that was just a bad month, right? And then you have another bad month. You're like, okay, it's just two bad months. And to be quite honest, looking back, I dealt with this for years, and then just reached a point finally of, okay, maybe this isn't. And the doctor that I was seeing at the time did do the ultrasound, did determine I had fibroids, and I believe that they did like a hysteroscopic myomectomy, and that took care of the situation for the time, right? That lasted maybe a few years. The fibroids, they come back or keep growing. And so I ended up in the same situation again, where it was constant flow, not going away. Had my aha moment of, okay, I've been here before. I know what this is. We should be able to do that same thing, right? That same procedure should take care of it. But I guess where my fibroids were located, or maybe because of the size, the option that I was given at that point in time was a hysterectomy. I didn't like that option. So I went to the second doctor to get that second opinion, and was told the same thing. And actually, Dr. Levine was my third option. And I will always be grateful. I had my husband come with me, and he had talked about, is there something cool you can do with lasers, right? Like instead of this semi-invasive procedure where you're removing otherwise, healthy organs, isn't there something cool you can do with lasers? And that's when Dr. Levine had brought up, there is this the clinical study that we're doing. Potentially, you could be a candidate, and The rest is history for me. It was life-changing, and easy, and 15 minutes of downtime. And I'm sure we'll get into more of that later, but um, absolutely incredible experience. And I have not had um, any symptoms, recurrence of the fibroids. I'm doing great 7 years later.
I love that. And that you said so many things that I think are really powerful that, people that are watching should hear again. One is you talking about how you did suffer in silence. And we hear a lot about women that, you have that bad month, you have that horrible experience where you have an embarrassing moment at an event where you bleed through your clothes or you wake up from your sleep and you're covered in blood, but then it goes away, and so then you kind of forget about it and it's not that bad, and you just suffer and you keep just pushing through because you're so busy doing everything for everyone else, you're so busy just running around in the world that when that moment passes it's like, okay, I could deal with it again until
Yeah, handle it.
the next
Yeah,
time
exactly.
comes. And so it's like when you did have, that aha moment that you're like, I've been here before and look how long I've suffered when you didn't really have to. It's like, having women understand that that's not normal and you don't have to suffer for that long is really important. And I think the other thing that is really powerful that we don't do enough of as women is understanding that you need to know your options and you have to empower yourself with the information of what your treatment options are, because a lot of times that first option that you're given, maybe a hysterectomy or whatever it is, and you don't know any different, and women trust the physician that they're going to see and they think that that's the best thing for them, when and ultimately every fibroid is different, every size is different, every location is different, and that helps to determine where and what makes sense for that woman as a treatment option. So really empowering yourself with the information, watching things like this, seeing a physician like Dr. Levine that's going to talk to you about all of your different treatment options is something that's just really so important. And I want to make sure that, the people watching are focused in on. And it really ties into a question that we just coincidentally actually got Dr. Levine, which is, does the size of a fibroid determine if someone is a good candidate for Sonata?
Size absolutely has something to do with it, but position in the uterus is even more important. And as I try to explain to my patients, I ask them to think about their uterus like an avocado and cut the avocado in half and pull out the pit. And fibroids literally grow in the meaty part of the avocado. And basically what they do is they stretch that tissue, or the fibroid grows closer to where the pit was that you removed, or it grows toward the shell. Well, the ones that grow toward the shell, they aren't as consequential as the ones that are growing toward the pit, because they're much easier to access, number one. And number two, they're probably the ones that are causing the heavy flow. Now, the ones closer to the shell, they may give you some pressure symptoms, but the heavy flow is being caused by the fibroids that are in the meaty part of the avocado, or in fact close to the shell. And as far as the size is concerned, I would say to you that most gynecologists who are performing this procedure will treat fibroids up to 10 centimeters. So there's lots of options. And the fibroid the size of 2 centimeters can give you heavy flow just as easily as an 8 centimeter fibroid.
Yeah, sometimes we hear that the smallest fibroids, you might have even said it, the smallest fibroids can cause the biggest problems.
Yeah, for sure, depending upon where they're located.
Yeah. So let's talk a little bit about all of the treatment options. I think it's important, to Amy's point of really knowing that that wasn't a solution for her with the first and second options that she was given. Uh, Dr. Levine, let's talk about the least invasive. So medical management. So when a patient goes and is diagnosed with fibroids and they say, okay, let's do medical management. Talk a little bit
Right.
about what is that? What does that mean?
Sure, medical management is typically something like birth control pills, where if the way it works is it decreases the the production of natural hormones, so that the uterus is basically responding to the birth control pills, which is significantly less hormone and thins out the lining, which makes the bleeding, which decreases the bleeding. Now that doesn't always work, but it's probably the first line is hormonal suppression. If bleeding is really heavy, we can use something called tranexamic acid, which decreases the flow during when the periods are very, very heavy, and that can be used for 5 days. Again, it's another band-aid to decrease the amount of flow. IUDs are effective sometimes. There are medications out there now that decrease the size of the fibroids, that are also that have a birth control element included with them. And again, these are all options that are non-invasive. However, they all have side effects. So anybody who's taken a birth control pill will tell you that they either had weight gain, or they had headaches, or they had irregular bleeding. So there's always a trade-off with that sort of hormonal suppression. But again, it's certainly your first line, okay? And then as you start moving along, endoscopic myomectomy. What happened with her is that one of her fibroids was sitting right in the middle of that avocado, right where the pit is. And it's really easy access because you can scrape that fibroid out and that'll decrease the bleeding immediately. So for her, that was a perfect option. The problem was she had a bunch of other fibroids that hadn't started acting up yet. And the one that they found, they treated, and they treated it successfully. Now, endometrial ablation is another option. Now, that's different than what we do. It's called global endometrial ablation. And what it does is it literally treats the entire lining. In other words, it heats up the lining and brings it down to the surface. The problem with that is it will only temporize because it can't reach the fibroids that are sitting in the meaty part of the avocado. So what's going to happen is those are going to continue to grow. So you'll get some minimal benefit from it. And you may get a year, you may get 2 years, but it's really not treating the problem. And then, of course, if we go to the other extreme, you can do myomectomy, which is literally making an incision through the abdomen and removing the fibroids themselves, leaving the uterus intact. And then, of course, the ultimate treatment is hysterectomy. But Sonata fits right in the middle. It's not as minimalist as birth control pills, but it's certainly not as aggressive as myomectomy and hysterectomy, because it has absolutely no recovery and there's no time out of work. So for the patients who are really who have fibroids that meet the criteria for Sonata, it's a perfect treatment because you don't have the side effects from the hormones, and you don't have the more aggressive treatment of a 2 to 5 week recovery. So for those of us who've been doing this surgery for a long time and been treating women with fibroids, this new technology was something we were looking for and has been a wonderful new tool for our armamentarium for treating fibroids.
Two questions that we hear a lot when we do patient education events, Dr. Levine. One that's tied to the medical management piece is a lot of times women don't realize or come back to us and say they didn't know that their fibroid would continue to grow when they were on medical management. And so when their symptoms were relieved, they thought that the fibroid had stopped growing when they went on to medical management. Can you talk a little bit about that being not?
Yeah, well, all fibroids, if you line up 10 fibroids, they're all going to grow at a different rate. I mean, it's totally unpredictable. And same woman, same uterus, 10 different fibroids grow at different rates. So basically what medical management does, it just slows that growth down. It doesn't stop it, it slows it. And so again, it temporizes until you have to do something more aggressive. So that's why it's this fallacy that if I do this, my fibroids aren't going to grow. Those fibroids are being fed every month by those hormones, regardless of whether they're your hormones or hormones we're giving you with a pill every morning.
Yeah, and what those women had said to us was they unfortunately, they had medically managed themselves out of some treatment options because they were on the medication for years, and then their fibroids continued to grow and grow and grow, where then they got to the point that, they needed something like a hysterectomy, which
Right.
is, unfortunate. Amy, you knew so much and had so much info. How did you find the information that you needed, to get your first procedure, to know that you didn't want a hysterectomy, to find out about Sonata? What was that digging for information like for you to kind of figure that out?
I don't know. I just didn't want a hysterectomy. I mean, it, to your point, Dr. Levine, the damn time, could I have gotten through it? I could have, but I like working out every single day. I have a full-time job. I didn't want to use 5 to 8 weeks worth of my PTO to take care of this. And I just kept thinking there's got to be something better. There's got to be another option. And I got very lucky because at the time when I met Dr. Levine, Sonata was not commercially available, right? So being able to participate in this clinical trial was absolutely life changing. And I would say to anyone now who is considering Sonata, absolutely go for it. I mean, my experience was, I don't know, was knocked out for what I felt like was, 15 minutes. Um, I woke up feeling fine. I was sent home the same day. I believe I took some Advil just as a precaution, like, oh, I might feel bad, so let me go ahead and take some Advil. Actually went shopping later on that day for a really cute dress. I was back at work the next day, and I have not had an issue since. And I'm 52 years old. I am still having regular periods, and they're light, they're manageable. They're the 5-day plan that Dr. Levine had mentioned earlier on. It was absolutely life changing, and one day out of my life. That's it.
Yeah,
And no incisions, no incisions.
yeah,
It's crazy.
and that was 7 years ago.
Yeah.
Yeah.
Wow. Dr. Levine, do you remember how many fibroids you treated on Amy? Or Amy, do you remember how many fibroids you had at that point when you went through Sonata?
No, I just know we got really excited
Don't
each time
remember.
we found one. We're getting everything ready for the clinical trials. Like, oh, another one we can get rid of, and that one too.
She may have had 3. I don't remember, but
More
yeah,
than one.
Stop.
Yeah. Yeah.
more than one.
And so day of, easy, in and out for you, shopping, which is amazing. And then since you've had the procedure, you haven't had, what was it like right after? Let's talk about like the day or week after. Did you have any symptoms after that? Any discomfort, anything that was bothersome after those few days?
No, I kept expecting, like, okay, surely one of these days I am going to feel, really uncomfortable, or have some pressure, or have a cramp, or have like a really, really, really heavy bleeding day, and I just didn't. I think it was over time that Sonata kind of made the impact of the fibroids that I had, but it was all completely manageable. No longer need to have a change of clothes with me, or additional supplies, or trying to schedule my life around when I thought my period was going to happen. I knew when it was going to happen, and it did. And then it lasted for the amount of time that it was supposed to. I mean, I can't say enough great things about my experience with it. Hands down, recommended to anybody that would be eligible, of course, but it was just a great option that wasn't readily available at the time I was going through this.
And Dr. Levine, what do you see from patients typically, as far as a recovery from Sonata? Is their experience similar to what Amy's talking about?
Yeah, I mean, typically there's a little bit of a discharge, maybe a little bit of spotting for a week, and sometimes up to 2 weeks, depending upon where that fibroid is, how much of that fibroid is sitting in the pit of the avocado, because obviously the more of that's going to slough over time. Um, and I try to set practical expectations. The first cycle, I'm not really thinking that their bleeding is going to get much better. But by cycle number 3, my expectation is that their bleeding is going to get 30% better. And by cycle number 12, it should be 70% better. And what's so interesting is Amy's a perfect example of somebody who said, look, I'm not one of these people that doesn't want to have a period. I'm fine having a period. I just don't want to bleed the way I bleed. And if you have something you can do for me so that I can decrease my flow significantly so it's not interfering with my life anymore, I'm in, I'm good. You don't have to stop my periods. I'm fine to have them. I just don't want to bleed the way I'm bleeding.
That's great. It's nice when, you could set those expectations with patients and then you're hearing that their experience meets the expectations that you're setting for them. I do have another question that came in through the chat. If anybody else out there has questions, feel free to put them in and we'll have them answered by Amy or Dr. Levine or myself. So this is more of a coverage question. So what are the costs for Sonata? Is it covered by insurance? And what is the out-of-pocket expense? So as far as coverage goes, as of January of this year, we're covered by almost all major carriers. Coverage, as well as Medicaid, which varies state by state. And we have some resources internally that can help you as a patient get the information that you need that's customized to your location and your coverage plan. So we have a nurse advocate who is a part of our team that can help to navigate you to a physician in your area, as well as an authorizations team that can help you from a coverage perspective to determine what the costs are. And then the out-of-pocket costs vary physician by physician. So it really depends on where you are, who your doctor is, what your coverage is, but we can help you with our internal resources to help you get the information that you need so that you understand what those costs are or what the coverage looks like for you. All right, so any other questions that are out there in the chat, feel free to put them in. And Dr. Levine, I think that for me, I would love for you to just share with the people that are watching a little bit of, what is your why did you decide so early on to be a part of one of the first to be a part of Sonata and doing the clinical trial, and why this many years later have you continued to offer this as a treatment for women?
Yeah, it's a great question. So I talk to docs about this all the time because personally I think that Sonata is a totally patient-driven procedure. Women are looking for alternatives. They're constantly told that their only option is hysterectomy or myomectomy. And depending upon how that hysterectomy is going to be done, it's either an afternoon in the hospital or a week in the hospital and 8 weeks recovery or, 2 to 3 week recovery. And so, having done these surgeries for a long time, I knew that there had to be a better way. There had to be an easier way to manage these issues, and particularly these particular fibroids. Because unless you're going to do hysterectomy and take everything out, trying to find these fibroids at the time of myomectomy, where you're trying to remove the fibroid itself and salvage the uterus, sometimes it's very difficult because they're deep in the muscle. So to me, when I was offered this opportunity, it seemed to me that here we have an indication, which is how to manage these fibroids, but we really didn't have a procedure until Sonata was presented to me. And the reason why it's so wonderful is because the entire procedure is performed inside the uterus. If there are no incisions, we dilate the cervix and we place an ultrasound probe inside the uterus. So we literally can see all of these fibroids. We know exactly where they are, and we know that we can access them if we can see them. So basically what it is we heat the fibroids to 100 degrees centigrade. And at 100 degrees centigrade, it destroys the fibroid. And the way I explain it to my patients is I say, look, your fibroid is like a cue ball that you hit on a pool table. And after I treat it at 100 degrees centigrade, I'm going to turn it into a marshmallow. And over that period of time, the fluid within that fibroid begins to shrink and be reabsorbed, just like any other organ system. And over time, this shrinks enough so it doesn't create the bleeding any longer. So for those of us who spend too long trying to find these small fibroids, it can be done in 45 minutes using Sonata without the recovery, and there's absolutely no pain. And people say, well, how can there be no pain? Well, the reason there's no pain is the way it works is the heat causes something we call coagulant necrosis. And coagulant necrosis just is a painless, it's a painless way of killing off those cells. So the women have absolutely no pain. So asking me what I was attracted to, that's what I was attracted to.
Yeah, and I think that you really tapped into something that's so important to women is that women are and were always waiting, as Amy was, for a treatment option that wouldn't take them weeks and weeks to recover. So women are just suffering through their symptoms of fibroids because they were waiting for this solution that could get them back to normal activity quickly, that was incisionless, and relatively no pain for them in recovery. So I think that it's really important that we have physicians like you that were early believers in finding this technology to offer women this treatment option. So we thank you for that. I have another question that came in for you, Dr. Levine. I am in menopause. The fibroid that has caused bleeding cycles in the past, with fibroid that has caused bleeding cycles in the past 4 months. I will have the Sonata procedure next month. Dr. Levine spoke about degrees of improvement with menstrual cycles. What might I notice as a person in menopause?
So I assume she's not bleeding anymore if she's menopausal. So obviously it's not going to be a cyclic bleed the way she would if she was still ovulating and menstruating normally. I guess the reason why she's having it done is she is having some bleeding, but my expectation would be it will be the 3-month wait. It'll take up to 3 months to see this fibroid shrink enough so that she no longer has any significant bleeding. It's a little different to explain once you're menopausal because you're not working on normal cycles anymore.
Again, any other questions, please put them in the chat and we'll have Dr. Levine answer those. My question is similar to, a little bit of what I asked Dr. Levine about what his why is. And for me, my question is like, why is it that you've turned so passionate about sharing your story? Because that's such a brave thing to do, is to kind of go public with, fibroids and embarrassing bleeding stories and talking to women on these platforms and educating them about fibroids and your experiences. Why is it important for women to know, about fibroids and what their treatment options are, including Sonata?
Just because there's a better option than what we're told. I had dinner with another friend maybe 2 months ago, and fibroids came up. I'm like, have I got someone for you to talk to? But just that very similar story of you just deal with it. You're told that really your only option is a hysterectomy. So the better option is I'm just going to deal with it versus put my life on hold for 5, 6, 8 weeks type of thing. So as much as possible, I would love for Sonata just to become part of the conversation. So anytime that you're talking about fibroids, this is one of your options in addition to hormones or the myomectomy or hysterectomy or all of these other things. I want it to become a lot more normalized. It's far less invasive too. So before you have a hysterectomy, why, if it's the right thing for you, why wouldn't you try this? Right? I don't know. I just think the more that we talk about it, the more that the Sonata name is out there, the more that other women will hear about it and go, hey, heard about this thing. Can you tell me more about that type of thing? You know?
Yes, I think it's very important. And that's really one of the main reasons that we're doing these Insight Live events, is because women don't really talk about fibroids in general. And if
Right.
there's, 80%, as Dr. Levine said, of women that are suffering from fibroids, some with symptoms, some with not, um, it's important that we just kind of break down that taboo of talking about irregular cycles and heavy menstrual bleeding and those types of things, because we see it time and time again when we're in a room and we say, oh, did you have heavy bleeding? Everyone's like, oh, I have fibroids. I know somebody, my sister has fibroids. So it's so much more common than what we ourselves think it is. So by being able to share the information, get the information out there, and just break down those walls of like, this isn't normal and this is what's normal, and educate yourself what the treatment options are, is really important. And by you sharing your story and doing things like this for us is one way that we're able to do that.
Yeah, absolutely.
So the next thing that I want to share with the group is really how to find a doctor in the area, in your area. So there is a locator that we have on sonatatreatment.com, that we'll put up for you at the end here. And there is a physician locator where you can find a physician in your area. So we have physicians like Dr. Levine that are treating all over the country, all over the world, actually. And it's important for you to find doctors like these who are going to talk to you about all of your different treatment options and make sure that they understand with you what your end journey looks like, and what are your fibroid type and location and all the things that Dr. Levine was talking about throughout this event, to make sure that they're putting together what that best treatment plan is for you. So if you go to our locator, you'll be able to find a doctor there. There's also information there to connect with our nurse advocate, who could talk to you in more detail about Sonata, about your specific case and information, and help to direct you to a physician in the area with your locator, as well as help to connect you with someone on our authorizations team if needed to get that insurance information that's important. And then our next episode will be at the end in a few weeks here on September 17th at the same time, 3 p.m. Pacific, 6 p.m. Eastern. So please be sure to come on again, and where we'll have another physician from a different part of the country, sharing their experience, as well as patients to share their information and story as well. So thank you, Dr. Levine, and thank you, Amy, for sharing your information, your knowledge, your stories, your experiences with us. And again, if anyone needs to connect with Dr. Levine directly, he is on our locator, or you could reach out to our nurse advocate, who will be happy to connect you with him in his office to schedule a consultation. Thank you all very much, and we will see you again on September 17th.
Thanks, Tara. Good to be with you.
Bye, everyone.